Good evening. Thank you so much for joining us. I'm Dan Edwards, and no, I am not a doctor, but I know people. We know who to talk to, the experts at Kettering Health, and we're going to chat live with you. Thank you so much for joining us. We do appreciate your time, and welcome to our Kettering Health Facebook Live chats. We get real in real time because we know you have questions. And this is absolutely free, so you're not going to get that anywhere else. And as people are logging in, we want to kind of set things up, share details of what we're doing here tonight. It is a live interactive forum for you, and for you to ask questions of our Kettering Health expert. And today's topic is, unfortunately, many have these issues that we're going to be talking about: bladder and pelvic health. Bladder and pelvic health, that is the topic. Do you have issues there? Well, do you have questions? We have an expert to talk to you about that right now. In the comfort of your home and the comfort of Dave Schoen's home. We thank Dave for allowing us in here tonight. So for the next 30 minutes now, we want you to log in, check it out, get your questions into us in the chat section. Weigh in now. We want to get as many of your questions in as we possibly can. And again, we only have about 28 minutes now as I continue to talk. So if you have any questions related to bladder or pelvic health, right now is a good time to submit those questions and utilizing that chat feature. Chris, our director, is going to relay your questions to us, and then we will share them with our expert today, who is, I think, a doctor who is making a house call tonight. Many house calls, I would imagine. And this doctor certainly is going to be helpful to you tonight. We welcome Kettering Health expert, Dr. Christopher Struachon.
Thank you for having me.
Thanks for being with us tonight.
Yes, sir.
Doctor, we do appreciate your patience as we set this up here on Facebook Chat Live. And Dr. Strong is a urogynecologist with over 9 years of experience, and he earned his undergraduate degree from the University of Dayton, and his doctor of osteopathic medicine from the Ohio University College of Osteopathic Medicine. And Dr. Strong then went on to complete his residency at Southview Medical Center, and he is board certified in obstetrics. That's why I'm not a doctor. I can't even say it.
OBGYN. We'll keep it easy. Keep it easy.
And he was also, I want to make sure I mention this, 9 years as a physician in the United States Air Force. And we thank you for your service, Dr. Very
Absolutely.
much. Another fun fact. This is his first Facebook Live chat.
It is.
So thank you again for being with us tonight. And you started out, and you're from the Cleveland area, so you're kind of a Buckeye boy, right?
I am. Yes, born and raised.
All right, and you've got a family, a lovely wife who's also a doctor.
Yes, my wife is.
Give him a shout out.
My wife is a OBGYN with Kettering Health as well, okay. And that's actually where we met. And then we have 3 small girls. Nora, Emma, and Maddie, 8, 6, and 4.
Oh, that's nice. Yeah. Are they watching tonight, do you think?
I don't know.
Are they busy doing something?
They're probably busy doing something.
All right, very good. Well, listen, let's just jump into it. Again, this in the chat section, please share your questions with us. We'd appreciate that, and we'll get to them just as quickly as we can. And I think we're going to be covering a couple of things here as we go to our slide. The urinary incontinence treatment that the doctor wants to cover tonight. Also, therapy thereof, as well as lifestyle changes. So those are kind of the topics we get started out on. Let me just start with the most basic. What does a urogynecologist do, Doc?
So a urogynecologist, otherwise known as a female pelvic reconstructive surgeon, is someone who specializes in a lot of the gynecologic processes that happen as a woman ages, specifically what's called pelvic organ prolapse, where in essence you lose support to the vagina and all the surrounding structures, rectum, bladder, and then dealing with a lot of bladder health issues, whether it be overactive bladder, whether it be incontinence, and that can come in kind of 2 forms, what's called stress incontinence, what people know as, I feel a laugh or cough coming on and I'm going to cross my legs.
Oh, how uncomfortable.
Yes. Yeah. Or that feeling of, urge incontinence, that gotta go feeling. Right. And if you're that type of person who has every bathroom mapped out in a 10-minute radius of your house, you probably fall more into that, or potentially what's called overflow incontinence, where you just can't empty your bladder because essentially it is what people know as dropped.
So we're talking a real quality of life issue for people.
Yes.
I mean, when you're sitting at, let's say, the Schuster Center, can you really enjoy the performance because I need to get out of here? that really is an issue. And how common is the issues that you speak?
So specifically when we're talking about urinary incontinence, overactive bladder, in women above the age of 30, it depends on the studies. It can go, prevalence can be anywhere between 25 to upwards of plus 50%. So, is it a normal part of aging? As we are meant to be told or led to be told, whether it's through advertisers or what. No, it's not a normal part of aging. I joke around with my patients all the time. I say, my beard getting gray is a normal part of aging. My hair falling out is a normal part of aging. But, peeing your pants is not a normal part of aging.
Right.
But it is common.
But it is common. They shouldn't feel badly about it. It happens.
Exactly.
And so what are some of the most common urinary issues that you see the most in your office?
So, it depends. If we're talking about women who have had kids, which are most of them, most will be familiar with the idea of, well, I had my baby and, ever since, I don't go on trampolines, or I went on trampolines for the first time and I discovered that will be the last time.
Amusement rides, going to Kings Island. I mean, you have to consider all those things.
It's all lifestyle type of activities. So that is actually pretty common. And then, the overactive bladder urge incontinence is a big part of our practice, coupled with, and a lot of this is they don't happen in a vacuum. A lot of these things happen together with pelvic organ prolapse. That feeling of, I feel like something's falling out and I bulge. I feel like I'm sitting on an egg all the time.
What exactly is that? I mean, how do you describe that to your
So,
patients?
in essence, what I say is, I'm a big analogy type of guy, and I warn people.
You have to keep it real.
Yeah, and I let them know, it's a bit of a crude analogy, but if you were to liken the vagina to a tube sock, if you were to put your hand all the way in and grab at the stitching where the toes are, start to pull down, depending on how much you pull that down, whether you come halfway through the sock or completely inverted.
That's a prolapse.
That's a prolapse,
Okay.
and that can happen either at the front part of the vaginal wall where the bladder is, the back part where the rectum is, or the top, or a combination of one or all three of them.
We're talking with Dr. Struachon from Kettering Health Network. And again, if you have any questions, don't hesitate to give us your questions in the chat section there, and we'll relay these to the doctor. You might have something that we haven't discussed yet, and we'd love to answer that for you. Let me ask you, in our society, we're not as healthy, we're not as physically fit as you would like to see. And it seems to be getting worse. And I don't think the pandemic helped anything. I read something that the average person gained over 12 pounds during the pandemic in the last 2.5 years. So with that said, is the lack of physical activity lending itself to these issues that we're seeing younger and younger women coming in with?
It can, specifically like you had mentioned with the weight gain. That is one of the things that's going to have a effect on the stress incontinence, as well as overactive bladder. Anything that's putting pressure on the bladder is going to, in essence, make some of these issues worse. So, things that people can do on their own, is weight loss, and that's going to have a myriad of benefits. But specifically with what we're dealing with, whether it's prolapse or whether it is incontinence, weight loss is a first great step. But what I often get from people is, I can't exercise because I'm leaking, or I can't exercise because I've got to go. And so they feel like they're chasing their tail. You're telling me I need to lose weight, but I can't because I'm having to do all these things. And that's where we have, other options to kind of get that ball rolling. But, you hate to, be a broken record, just like the rest of the medical community is. But weight loss is one of those things that has a big effect on a multitude of health problems.
I know this is probably hard to qualify, but we are supposed to have a certain allotment of water in our diet each and every day.
That is, the old adage of 8 glasses a day. That's false. That actually was just, conjecture. based off of a physician in the 1920s.
Really?
We just said, yes, I believe that
8 12-ounce glasses a day,
yeah,
right?
that's what I feel is right. But you know, there was a great article going back probably about 15 years ago in the New York Times that actually addressed this, and essentially it debunked it. You know,
Really?
drink when you're healthy.
Yeah.
Your kidneys and your endocrine system will do a wonderful job of letting you know when you need water. So I get this a lot. A lot of people who, you know, big water craze. I drink a gallon of water a day, but I can't stop peeing all the time.
Right.
And I let them know that's a good thing. Let you know that your kidneys
Heck yeah,
are working.
your plumbing's working.
Your kidneys are working. It's doing
That's right.
what it's designed to do.
Sure.
So there's certain things that we do in our daily habits, just living life, that actually contribute to whether it's the urgency, the frequency component of it. And so part of, you know, what I do is help to figure that out.
Right,
And
right.
you know, I am. I tell people this all the time. I'm a pelvic surgeon who loves doing surgery on people who have an indication with that's what they want, and that's what they want to do. If you don't have an indication or that's not what you want to do, we're not going to push you down that, but we are going to help you to, you know, gain control, get some power, and figure out how do I take care of some of this on my own.
Right. I guess as a follow-up question to the original, is there a certain amount of times per day a person should go to the restroom to
No,
pee?
I mean, that's all going to be dependent on what you are doing. You know, there's essentially 3 ways that your body's going to get rid of excess water: through breathing, through sweating, and through urination. And so if you find yourself, you're out in the heat all day and you're working hard and you're sweating a lot, I think we've all been in that situation where you realize, I haven't peed in the past 10 hours because I've been outside. Well, you've been losing your excess water through sweats. So in that case, you might be drinking a lot of water, but not peeing a lot, but that is physiologically normal.
Yeah. Excuse me. There must be a certain amount of walls that you kind of have to break down with patients because it's a very personal thing. How do you go about doing that, making them comfortable with a very uncomfortable situation?
In essence, I treat people the way that, you know, I would like to be treated, you know, which is an upfront, honest approach, and also letting everyone know what to expect with. So when I walk into a patient's room, you know, we sit down, we have a conversation. And then from there, even before I have touched the patient for a physical exam, I'm going to explain to them, here is the whole process of the physical exam. And then let them know when I'm done with the physical exam, I step out so you can put your pants on, because I find that most women like talking to me when they have their pants on.
I'm sure they do.
Yeah. And then after that, then we talk about kind of what's going on, and then here are your treatment options for what is going on. And let people know that, you know, they're the captain of the ship. You know, my job is I'm the navigator. I'm here to let you know kind of what's going on, but ultimately the decision is yours.
Yeah. Hey, let's circle back to the age of when these, like incontinence and things. Does it really matter with hereditary DNA or anything like that? Or?
So specifically with stress incontinence, you know, a lot of it.
Stress incontinence.
So that is the leak. That is the leaking with activity, whether it's a cough, laugh, sneeze, trampolines, exercise, whatever.
Yeah.
A lot of that is dependent on, you know, what kind of connective tissue did you inherit? Because that is part of the support mechanism for the urethra. But a big part of your biggest risk for that is, you know, have you had children, specifically, have you had children vaginally?
Right. So it does. That does play into it. So you might want to consult with your. I'm going to make sure we're not missing any questions here. People might be chatting in. Okay. So that may play into it. Now, here's something that affects men and women, OAB, but it's different for men though, overactive bladder, so we know exactly what we're talking about. But that obviously has, with your expertise, affects women more, men more, or it's just in a different area?
Yeah, it affects men and women differently for different reasons, but, you know, specifically in context of women, you know, it is a constellation of symptoms that is grouped together as what we know, overactive bladder. So that urgency, that feeling of, man, I have to go, and I have to go now. And if we don't find a bathroom in the next couple minutes, you're going to need a new chair.
I'm in big trouble.
Yeah, exactly.
Gotcha.
It is that frequency, that feeling of you're urinating all the time. And then specifically, too, getting up at night, what we call nocturia. So typically,
it's called what?
Nocturia. or nocturia. Yep.
Okay.
So if you find yourself getting up specifically to pee, being woken up because of that more than once a night, that typically isn't normal, and there's a reason typically behind that.
I have a question here.
Sure.
The chat person wants to know what exercises are good to strengthen the pelvic floor.
So you'll hear people talk about Kegels a lot.
Kegels.
Yes, Kegel exercises, which is engaging the muscles of the pelvic floor in order to be able to use those kind of as a support structure, so that urethra can be kinked when or kind of like a garden hose when you step on it.
Sure.
When you feel a cough, laugh, sneeze coming on. Now, I tell people this all the time. I can sit here and I can show you how to make flex a bicep. It's very hard for me to show you how to flex the muscles of your pelvic floor effectively. And so that is one of the beauties of pelvic floor physical therapy. These are physical therapists that work directly with the pelvis, the muscles of the pelvis, and working to help with urinary incontinence issues, fecal incontinence issues, and some prolapse issues. So a lot of times I'll direct patients towards physical therapy because, again, just doing Kegels indiscriminately, you might not be engaging the right muscles.
Sure.
You might not be doing it the right way.
Very refined set,
just like any
sure.
other exercise. If you don't have expertise or guidance training, you might be doing it wrong.
Right. And that's all available through Kettering Health.
Absolutely.
Okay.
Absolutely.
Another, again, how do you treat stress incontinence?
So stress incontinence can be treated whether it's through lifestyle modifications, weight loss. What I tell most people and what studies show, about a 10% loss in total body weight leads to about a 40 to 50% reduction. Because again, it's if you can reduce all the stress on top of the bladder, it's going to reduce that. If that doesn't work, pelvic floor physical therapy is a great place, a non-invasive place to start. Sometimes a device called a pessary, which is a vaginal device that is placed inside the vagina that can add supports to the urethra. If that doesn't work, then we're talking procedural. And a lot of people are familiar with or have seen commercials about slings and things like that, and that is a wonderful approach. Another thing is kind of newer to the market, urethral bulking, where essentially we're using a gel-like material, and inside the urethra, we're injecting it underneath the lining of the urethra. So what we're doing is trying to shorten that distance that the walls of the hose need to travel. The wonderful thing about that is it's an outpatient procedure. You're back to normal activity that day, exercising, intercourse, the whole nine.
Does intercourse play a role in this? So
some women may experience some what we call coital incontinence, or incontinence associated with intercourse. And it specifically is not contributory, but it may be normal to experience your incontinence during intercourse.
Okay. You talked about the stress incontinence from just the bulk of your body mass. Is there stress of like societal stress, of pandemic stress? Does that have any bearing on the physical nature of this problem?
It's hard to say. So when talking about OAB, I let patients know the bladder's in constant communication with the brain's in constant communication with the bladder. And when you get that disconnect, we're not exactly sure why and how that is happening. So a lot of our treatment options are based off of trying to regulate that signaling, whether it's through medications, and medications work by essentially a lot of the neurotransmitters that are coming from the nerves to the bladder, or it's relearning habits through pelvic floor physical therapy, bladder retraining, or other things like Botox in the bladder is another big thing.
Botox?
Yes.
Interesting.
So it's not just for the face, and it's not just for wrinkles.
I'll be darned.
We'll use it where we inject Botox into the bladder wall. Again, simple outpatient procedure. Another thing that is wildly successful is what's called neuromodulation. And the best way to think about that is it's kind of like a pacemaker for the bladder. And so it's regulating the signaling by giving gentle electrical stimulation to the nerves going to and from the bladder. The same way that a pacemaker for the heart will regulate the heart through electrical stimulation, will regulate the bladder through electrical stimulation.
Well, I've read that with men, the OAB, overactive bladder, it can also be. Can you trigger it mentally? Can you talk yourself into it? Is that part of it, or can you talk yourself out of it?
Well, again, going back to those learned habits, if I let patients know that the water or the bladder is nothing more than a watertight bag of muscle, and it can be trained. And if you are allowing yourself to go to the bathroom every single time that you get an urge, then your bladder's getting used to being full without having much in it. And so that's where bladder retraining, pelvic floor physical therapy can be helpful in learning those or breaking those habits so that you can begin to get the bladder fuller without feeling fuller.
We're talking to Dr. Struachon from Kettering Health, and we would love to take your question. If you have one, please, if you would put it in the chat box, and we'll relay it on to the doctor as we continue with one of the things that I've talked with several doctors is making sure that what's the average time that you spend with your patients?
So I typically spend about 30 minutes with a new patient.
Which is a long time as doctors go. So to economize your time and to be efficient, some doctors have shared with me that maybe you walk in with notes, or I don't know if this is something that your spouse comes along with you on that. I mean, you certainly
absolutely
you can if you want to.
Encourage it.
Yeah, okay. You encourage it. Fantastic. So with that said, should we come in prepared with notes? Because I know a lot of times you get in with the doctor and you get a little intimidated. Here's our doctor. Oh my God, you've been waiting for a month or so to get in. So should they do their due diligence before they get to you and take notes of what's happening?
Absolutely. So I always encourage patients to do their own research. And
where do you send them? New England Journal of Medicine, or what do you go?
No, a lot of times, online chat groups can be helpful. Well, some of it might not be credible evidence or experience. It's still helpful to come in and have some exposure to kind of what's going on, and we can talk through everything together. And as part of my new patient appointments, I give everyone out a written summary of kind of what's going on and what are the treatment options that are available, so that then you can go back and again do your own research, and you've got everything spelled out for you. So you're not having to spend time trying to focus and say, oh, what was it that the doctor told me about, and then get lost down a rabbit hole.
Hey, a couple more we want to try to squeeze in here. We're running out of time, so if you have a question, please get it in the chat box. Can frequently passing kidney stones cause incontinence?
It's hard to say. So kidney stones will cause a lot of urgency, overactive bladder. The kidney stone, anything in the bladder, foreign material, whether it's stone, whether it's mesh, whether it's a mass, is going to give you those symptoms of overactive bladder and can give you that incontinence as well, and more typically towards that urge side of things. Taking care of the kidney stones might alleviate that. It might not. You just might have something that's underlying urge incontinence. So it would be helpful to have that come in and be evaluated.
Do you have any thoughts on you mentioned mesh? Is there anything that we should share with our audience about that topic?
Well, I spend probably about 2-3 minutes every time I'm talking about mesh with people, giving them some background with the legal commercials that they're seeing. And there is concern to be had, anytime that you're placing mesh, I can't promise 100% success, nor can I deliver that. But, in the right hands, in the trained hands, mesh is a very useful, a very safe and effective treatment option and a tool. A lot of what we saw and got bad press with the FDA had to deal with people who didn't necessarily have the training that a urogynecologist has and using the mesh anyways. So
excellent questions coming in. Another one: how much does a hysterectomy affect the bladder and possibly
wonderful question. So when one of the risk factors for the development of pelvic organ prolapse or things falling down is actually having a hysterectomy. So in order to be able to safely do a hysterectomy, you have to cut through some of that support mechanism. So you'll see it fairly commonly in patients that will develop weaknesses either underneath the urethra, the top of the vagina, the front of the vagina.
Okay.
So,
and can you reverse prolapse with exercise?
no. So once it's there, it's
Okay.
there. Now, exercising may help prevent progression, but it's not going to reverse at that point.
All right, so as we're kind of wrapping things up here, we have about 3 minutes, so quickly get those questions into the chat box. Maybe kind of a wrap up. Again, what lifestyle modifications would you recommend to prevent incontinence?
So watch your weight. Watch how much fluid that you're drinking, what type of fluid that you're drinking. So a lot of caffeinated beverages are going to stimulate the bladder, irritate the bladder. Artificial sweeteners are going to be another thing that are going to caffeinate. And remember, your fluid intake is not just in what you drink, it's also in what you eat. So I'll see it actually in a lot of people who eat mainly fruits, vegetables, and whatnot, and they'll actually be taking on a lot of water through their foods. So those are quick, easy, common type of lifestyle modifications that you can watch.
Alcohol
and smoking.
Smoking.
And alcohol, yes.
Okay.
But smoking in particular. Most women don't realize that smoking actually is a causative factor for bladder cancer.
A stimulant? Is that basically
well,
the tobacco?
yes, yep, it can,
Okay.
but it can also cause bladder cancer as well.
Okay. Any other words of advice that maybe I haven't touched upon tonight that you'd like to share with the audience?
Just want to let everyone know this is it. You're not alone. You know, a lot of women experience this, whether it is the prolapse, whether it's the urinary incontinence, or it's the fecal incontinence. And that's another thing that's really taboo, that you have to kind of tease out of patients on that. And we have treatment options that are wildly successful for all three. But you know, we can't help you if you don't come in and you don't let us know.
Right. So is that as prominent as urinary?
It's not as prominent, thank God. But it is for whomever's suffering from it. It might as well be the only thing that's going on.
No doubt about it.
And so they don't need to suffer in silence.
Yeah.
And wearing the pads and wearing the diapers, that's not a treatment. And I want to let everyone know that there is hope and there are good treatments that can give you your life back that don't require wearing a pad or a diaper.
Yeah. So start with you. Start with you, man. Come on, you know, and you don't have to go through this alone. And there are treatments that can certainly help. And that's words of good advice and inspiration tonight too. Let's see. Let's squeeze one more in here. Can bladder cancer be missed by labs and technicians?
So potentially yes. Your biggest sign of bladder cancer is actually going to be blood in your urine. So if you see blood in your urine, tell your doctor so that you can be evaluated.
All right, very good. Well, Dr. Struachon, thank you for your time this evening. That's great information.
Absolutely.
Absolutely. And we appreciate your time, your expertise, and your obvious compassion and passion for this topic.
Yes.
And just don't worry about it. We've got experts here who can take care of you at Kettering Health. By the way, if you need more information, we want you to go to ketteringhealth.org/services/women's-health/urogynecology. Thank goodness I didn't have to say obstetrics or whatever.
Yeah, there you go. You got it right the last time. That's all that matters.
That's right. Well, join us for our next Kettering Health Facebook live chat. It'll be April 26th, and we want you to log on, view us on Facebook, wherever. And our topic is going to be stroke health. Stroke Health, featuring Megan Skidmore, PT and DPT. And she is, of course, a physical therapist at the Neuro Rehab and Balance Center. And you can learn about stroke health as well as the treatment options that will help you live a healthier life. So look for updates on our Facebook page. And again, thank you, Dr. Struachon, for being with us.
Thank you for having me. I appreciate it.
Nice little chat today. I'm Dan Edwards. Thank you for joining us here at the Kettering Health Chats Live and our conversation. On behalf of everyone here, we hope you have a safe and healthy and warm evening. And it's Kettering Health Chats Live. Kettering Health, be your best. See you next time.